Hello guys, so we're going to be talking about motor speech disorders, dysarthria in particular. My name is Alondra.
My name is Adrian.
My name is Aleida.
So did you know that approximately 7.5 million people in the United States have trouble using their voice?
Or did you know that it is estimated that over 130,000 individuals struggle with dysarthria?
Or did you know that dysarthria can occur at birth or develop later in life?
So what are motor speech disorders? Motor speech disorders are speech disorders resulting from neurological damage. This affects the motor control of speech muscles or motor programming of speech movements. The most common motor speech disorders are dysarthria and apraxia of speech, and these speech disorders can result in weakness, incoordination, or paralysis of the speech muscular structure. So what is dysarthria? Dysarthria is a speech disorder that occurs due to muscle weakness caused by brain damage, and motor speech disorders like dysarthria result from damage to the nervous system and can range from mild to severe. In dysarthria, the muscles used to speak become damaged, paralyzed, or weakened, and dysarthria may occur with other speech and language problems such as apraxia of speech.
Now moving on to the causes of dysarthria. The common causes include nervous system disorders and conditions that cause facial paralysis of the tongue or throat, such as stroke, brain injury, tumors, or Parkinson's disease. And they can be either congenital or occur after an injury or illness. Now moving on to the signs and symptoms. The symptoms of dysarthria are having slurred or mumbled speech, being more slow-paced or high-paced, speaking softly, not being able to move your tongue, lips, or jaw very well, or having changes in your voice, such as being more hoarse or breathy.
All right, so now we're going to move on to the types of dysarthria. So there are two types. We have flaccid and spastic. So with flaccid, it occurs because of poor muscle tone and weakness. So with that being said, there's usually problems in the lower motor neuron system. And with that, it'll be lesions to one or more cranial spinal nerves. So because of this, the muscles are cut off or then weakened. Whereas with spastic, it occurs in the upper motor neurons, so above the medulla oblongata, problems in the neuromuscular execution, and it's most apparent in weaknesses in the tongue. Also, the range of lip retraction is reduced, and there's also slow palatal movement. Continuing on with the differences, so with flaccid, some of the causes could be traumatic, muscle disease, or vascular, so like brainstem stroke or tumors. And some of the characteristics could be weakness, hypotonia, or reduced reflexes. Now with spastic, some of the causes could be degenerative, congenital, or demyelinating, such as ALS, cerebral palsy. And some of the characteristics you can see is acute lesion, reflexes diminish, and spasticity.
Now moving on to treatment of dysarthria, as well as how an SLP can help. If you have dysarthria, you can often work with the SLP depending on the type of dysarthria you have and how severe it is. For example, you would be working on slowing down your speech, using more breath to speak louder, making your mouth muscles stronger, or moving your lips and tongue more. Also, you can work with saying sounds more clearly or using other ways to communicate, such as gestures, writing, or using technologies like an AAC device. And finally, an SLP can work with your family and friends by teaching them ways to communicate with you and also to understand you better. And thank you for listening.
Thank you.
Thank you. These are our references, and you can educate yourself on dysarthria and be more knowledgeable. Goodbye.